Ask the Expert. Here to answer your questions live on air is National Medical Director and Vice President of One Medical, Dr. Natasha Bhuyan. The topic today is dry January. So our first question, Shannon in Buckeye says, is there a difference between drinking beer, wine, or liquor? Is one better for you than the others?
Okay, great question, Shannon. I hear this quite often. So now we know that wine has resveratrol in it.
Yes.
And so that is a compound that acts like an antioxidant. So a lot of people think that wine is healthier.
Right.
But researchers have actually said it doesn't matter the type of alcohol you drink. What's more important are your own individual drinking habits. So if you're drinking a lot of alcohol every single day, that's unhealthy. If you're drinking in moderation, that's fine. But there is no recommendation on one specific type being healthier than the others.
Oh, that's so interesting. All right. Ellen from Phoenix says, I keep hearing mixed reports on alcohol. Some say a little is good. Others say it's not. What's the bottom line? This kind of goes back to what you were saying about the red wine.
There's some research. There's been years of research that say if you drink alcohol in moderation, it can be protective for heart disease and might reduce the risk of diabetes. Now, there's newer research that's saying that might not be the case because we can't, correct for people's own genetics. The people who are drinking in moderation, do they have healthier lifestyles otherwise? And so the bottom line now is experts say if you don't drink alcohol at all, you shouldn't start. But if you do drink alcohol, you should just drink in moderation to make sure that you get those health benefits.
Okay, so what exactly would be the barometer? What's moderation?
Moderation, yeah. So
2 times a week?
Moderation's really, for a female, it's less than 1 drink a day, and for a male, it's less than 2 drinks a day. That being said, we don't want people to be drinking daily
every day.
Yeah. And so for a lot of people, it might be a couple of drinks on the weekend, maybe once in the week, but that really is the definition of moderation.
Okay, good to know. Kathy from Queen Creek says, what if I can't go the whole month without any alcohol? What are some other ways of moderation? That's a good one.
Yeah, that's a good one. And I will give this caveat. So dry January, it's not intended for people who are struggling with alcohol addiction. So people who feel like they cannot quit drinking alcohol and they want to be sober, they should get professional help. Reach out to a doctor who can help you get sober and stay sober. But for other people who are just looking to cut back and you don't want to cut back entirely, there's other ways, right? So you could swap out every other drink, might be alcoholic. When you go to the bar, you can ask your bartender to make a low alcoholic drink.
I do that all the time. I'm a lightweight.
So there's other ways if you want to drink in moderation, but you don't want to cut out alcohol. But caveat, if you feel like you have an alcohol addiction, it is really important to reach out to your doctor.
I'm glad you said that. All right, thank you so much. Ben from Surprise says, I've heard of damp January. I have not. That's interesting. So how do you do that? How do we do that?
Yeah, damp January. I love this term because it's not the idea of cutting out alcohol entirely. It's just reducing alcohol intake. The nice thing about damp January is if you do damp January, it can turn into damp February and March and April because you're able to just reduce your alcohol consumption. And so there's a couple ways to do this. You can designate 1 or 2 days of the week that you can drink alcohol. You can swap every other drink to be alcoholic. You can also just have less alcohol content in your drink, but it's this idea of not cutting out alcohol entirely. That way you can make it sustainable.
Yeah, so it goes back to moderation.
It's all about moderation when it comes to alcohol, exactly.
Yeah, okay. Lily from Glendale says, how much is too much?
Yeah, so there is a definition of binge drinking. And so we want people to avoid binge drinking. And so for women, if you drink more than 4 drinks in one setting, or for men, more than 5 drinks in one setting, that's binge drinking. And so now what is an actual drink? A drink definition, it's for a beer, 12 ounces. For wine, a drink is considered less than 5 ounces. And if you're drinking a cocktail, it's 1.5 ounces of the hard liquor. And so we don't want someone, drinking a whole goblet of 16 ounces of wine and saying, I just have 1 glass of wine.
One serving.
And so
exactly.
I think that it is really important to kind of monitor your alcohol intake.
Oh, that's so interesting with the ounces. I did not hear that before. All right, Natasha, thank you so much. That was so enlightening.
Yeah, good luck to everyone.
What is that younger generation calling it?
Gen Z. They are being sober curious in the no-low movement.
No low, sober curious. All right, very fascinating. Okay.